Good morning, students of Sri Krishna College of Pharmaceutical Sciences and Research Center, Parashala. I would like to welcome my PharmD students year 2, and now the batch is with full strength. And here you have gone through many classes, but still I would like to remind you that you were having your exams, especially for Pharmacognosy and Phytopharmaceuticals. For you, the exam will start, especially not this exam will be in next week. Actually, from next week you will start your other exams, and in this, as per the schedule, you will be having in the next couple of days. You will have this first sessional examination. So when you want to prepare for your examination, it is very much needed for you to know about the subject and the syllabus according to KUHAS, Kerala University of Health Sciences, and you should follow that syllabus. And if you have any doubt, you have to go through that and you have to ask with your teacher, and you can ask with me. If we are not going along with the syllabus, and if you are having a wide syllabus according to PCI and KUHAS, so anyhow you have to prepare yourself after listening to the lecture and listening to the guidance which you are getting from the teacher. We have very good eminent teacher in our institution, Sri Krishna College of Pharmaceutical Sciences and Research, Parashala, Trivandrum. So I would like to give you the lecture just to start with the introduction and history which is included in this examination. Especially I discussed with our teachers who are handling this subject for you, and I came to know that they have given the syllabus, the introduction, history, cultivation, collection, and adulteration, and the cell structures, histological structures, what all the plant cell structures, and basic natural structures, definitions. This all comes in this first sessional examination. So students are requested to prepare yourself, listen to my classes, which are not only this class, there are many classes are available in the YouTube, and you can just listen to the classes. If you are unable to visualize, you can listen the audio, and so that you will get the language which can be transmitted in your paper. As you may think, I have a 1 year period of time to study the course. It's a vast one, so every time, every session, the students have to prepare themselves very strongly, as if you should think that this is my final exam. So always examination means no students will think that I want to fail in an exam, I want to pass in the exam, I want to first top in the exam. So that should be the main motive and positive thinking. I'm glad to say that I'm just giving the lecture for you after an 8 months, 7 months gap due to my health issues. Now God have given me a second rival for lecturing and delivering to my children, for the pharmacy students, to give various lectures. So I think now I'm fine, and I am with my health issues I have gone through, and now I am coming for these classes. This is just an introduction for pharmacognosy, the first chapter, and we have many chapters they have already covered, but this is just a revision, or you can take this as a point of view to know the studies and examination. You can prepare for the examination, because your exams, usually in your final exam, you might have appeared for your first PharmD, and now you have come to the second PharmD. You may be knowing there will be 5 mark question and there will be 10 mark questions. So you should have a vast writing capacity. So if you want to write, if you want to express in a paper, it needs more language, depth of the language to write. If you are someone who want to write, the listening and the language you should reach your brain and to have a language to write down in the paper. So the word pharmacognosy is derived from the Greek pharmakon, the meaning of drug, the meaning a drug or a poison. So why a drug also or a poison, why they means it's a xenobiotics, which is a foreign body, which is not a food, which is entering into your body as a foreign body. So it's a xenobiotic, that's why it can be called as a poison also. So pharmakon is a word which is taken from the Greek, and gnosis is also a word taken from the Greek language, and which is known as the knowledge, entire knowledge. So totally pharmacognosy means the entire knowledge of the drug. So if you see this picture, that is very clear from the Greek word pharmakon, which makes drug, and gnosko or gnosis or gnosko is the word which comes from the Greek language. It's called entire knowledge. And so that pharmacognosy is called as the entire knowledge of a drug. So when you come to see, we should know that what is the introduction and the basic, what all the things you will be studying in a pharmacognosy, what all the things you have to study in future. And when you take a pharmacognosy book, what all the things will be appear. And what is the subject, depth of the subject. These are the things which you are going to see in the introduction part. Is it possible for them to ask me this question in my paper? Yes. They can ask you scope of pharmacognosy, that is another small topic. This is about history of pharmacognosy and definition of pharmacognosy. So the student should know what is pharmacognosy. Anywhere, if you want to subject, any subject, if you want to know to write, what is it? What is its important? What is its significant? These all things have to be known by the student or by the person, then only he can express in the paper. So the scientific study of structural, physical, chemical and sensory characters. So structural, chemical structures and physical and chemical characters. Apart from that, sensory characters. What do you mean by sensory characters? Like smell, taste, odor. These all comes, and also physical characters like texture and a fracture, and the physical characters like even melting point, boiling point. Many things are there. Just I told melting point and boiling point, physical solubility. There are many things, physical characters. Structural, chemical structures. And the crude drug of vegetable origin means plant origin, animal origin or mineral origin. So the plants, the drugs which is obtained from plants, animals and minerals are coming under pharmacognosy for its study. It includes also the history of the plant, history of the animal, history of the mineral, how it is cultivated, how it has come to, from where, geographical history and the cultivational history. So next it is cultivation of the medicinal plants, producing them, and the method involved in the collection. There are many different types of collections are there. Sometimes we will cut, sometimes we will dig, sometimes we will, after collection we will be washing, processing that one, and collection techniques, climbing and collecting, completely uprooting and completely sacrificing the plant or sacrificing the animal and collecting. So these type of things, collection may have some, and many types of studies are there, involves in their collection, cultivation, medicinal plants, producing them, and method involved in their collection, and other particulars related to treat them, receiving during their passage from producer, that means the cultivator or the agriculturist or the medicinal plant cultivator who cultivates, and to the distributor, to the pharmacist, and to the even to the consumer, the patient, or to the collecting the drugs. What do you mean by crude drug? When you say the word crude means before processing. Something which is extensive processing is not undergone extensive processing or modification or any type of chemical changes or any type of alteration which you have not done, you have taken crudely from a nature, whether it is obtained from plants or animals for any sources, then it is called crude drug. So this is very important for the student to know that what is a crude drug. It means the harvested and usually dried plants or animal sources of pharmaceutical and medicinal uses product before they have undergone extensive processing or modification. So this is the word which the students should pierce into their mind. That is, that crude drug means any drug which is obtained from plants or animals or a mineral source which is not undergone any type of extensive processing or before extensive processing or modification, then it can be called as crude drug. Crude drug are derived from minerals, vegetables, that means plants, and animal kingdom. Crude drugs of vegetables, animals, and minerals origin form the subject matter of the pharmacognosy is concerned. All the subjects. So what are the things? Example of crude drugs. Entire plants can also be a crude drug. Like mentha plant, the whole plant is used as a drug and also is a very good flavoring agent. Entire plant. Lobelia, that is cathrandris, or that is cathrandis or canthrandis, you can say. Canthrandis is an animal, it's an insect, you can see that. Cochineal. These all of them are whole plants and whole animals have been used. So when you come to an entire organ sometimes, liver, heart, skin, animals means, plants means bark, leaf, root, stem, flower, fruit. So the part of the plant, part of the animal, they are entire organ of the plants. And animals like senna, leaf, clove, flower bud, fennel, fruit, linseed seed, quassia wood, cinchona bark, licorice root, thyroid gland. Mineral, task, kaolin, talc. Minerals, when you see it, chalk, kaolin, talc. They are minerals, which can be an example. So substance, so these all are, when you come to that, up to this, you can see, for example, before minerals, you can see that entire plants or animals or organs, then they are called cellular organs. They have cellular structure. They have structure of cellular structures. That's why they are called organized drug. When you come to an unorganized drug, there are unorganized drug. What do you mean by unorganized drug? They are not having any cellular structure like leaf, root, stem, heart or skin or a whole plant or whole animal which is having a cellular substance. They are exudates. They are produced, they are derived from the plant. Like opium, you see the picture? There we can see the fruit have been made some insertion by knife and a latex will come outside. That latex will have morphine, thebaine, codeine. They are very highly useful drugs. So resin, stregoganth, aloes. This is aloes. So these all are some of the substances which can be used as an unorganized drug. So students should know what is organized drug, what is unorganized drug. Even the next chapter this teacher might have taught you, you might have studied about the classification of drugs. In that they might have classified many classification. You might have studied alphabetical classification, taxonomical classification and chemical classification, pharmacological classification, serological serotaxonomy classification, and you might have studied even the therapeutic classification. There are many type of classification. Drugs can be classified in many manner. according to their use and application and their structure. So, morphological classification. And in this specifically there is a difference, organized and unorganized. So there is a major classification which you have to remember, organized and unorganized. Organ means organs, whole plants, whole animals, organs of the plants, organs of the animals, they are called organized drug. Unorganized drug means drugs which are derived from the plant, derived from the animal, like exudates, resins, by making incisions, gums. This all comes in the unorganized drug. For a detailed description of each individual for the drug points, what will be there in a pharmacognosy book about one crude drug? First they will give you the origin, including biological, botanical source, geographical source, where it is obtained from Africa or India or Asia or it is Europe. These all things, they will be mentioned very clearly. Origin and cultivation, sometimes submitted wild plant or wild which is existing in that particular place, geographical place. So geographical source and the knowledge of history and the name of the drug, these all important for them to, evident for them to use. Cultivation and preparation include details of cultivation of the medicinal plants, methods of collection, drying, packing and other treatment of drugs during its preparation of the market. So these are the next one. And the third one, cultivation. First one is, you should remember 7 points are there. All 7 points you should remember. The first one is biological, geographical sources. Second one is, you should remember, you should have an idea about that. Don't forget about cultivation and preparation. That all thing collection all comes there. And then characterized, including physical characters, dimension, surface characters, fracture, sensory characters, color, odor and taste. Then comes histological characters, microscopical characters. As a botany, when you want to see the section of the, if it is animal also, skin, tissue, section, what is the internal organism, what is the section of the, what is the TS, transverse section, what is the powder microscopy. If the drug is available in the form of powder, you should mention what is the powder microscopy, whether the drug is not adulterated with any other powder. So the fundamental importance, powder form, these all things, the drug powder form, identification, which all helps to identify the particular structure. Number 4, you should see the constituents and test, very important. When you see the plants or animals, chemical constituents in the plants, you should know that there are alkaloids, glycosides, flavonoids, phenolic compounds, steroids, and still there are many saponin glycosides, there is saponins, and there are many substances which are having many uses and application, even tannins, and that steroids, these all are chemical tests can be used. And food substances, especially if you see in carbohydrate itself, rice carbohydrate, tapioca carbohydrate, that means starch, rice starch, tapioca starch, wheat starch, everything having different types of physical character and chemical characters. So these all things have to be chemically identified. This is the pharmacist's job. Have to be identified, purified, and you are responsible for giving the exact quality, and the efficacy and the safety is the important factor which comes under our pharmaceutical care and health care system. So this comes in the book. And also next one is adulteration. This is very common and it is a chapter itself. You have to study about adulteration, how they are adulteration, that are the different types of adulteration. Intentionally, somebody who is adding water with the milk is intentionally he want to increase the quantity to give the profit. Somebody adding stones in the rice for their selling, that is increasing the weight. But these all are making problem in the food items. But in the drugs also sometimes inferior quality for the price, intentionally done. Non-intentionally, sometimes somebody who is having less knowledge in collection, he might collect instead of leaf, he might collect some other leaf nearby. The drugs may not be identified properly. So lack of knowledge, lack of education, this makes the person to go for adulteration without knowledge. So deliberately, undeliberately also there are possible for adulteration, but it should be identified by the pharmacist. So that's why it's very important for you to know, because as I said, according to WHO, it is very much needed. Whatever the drugs which is supplied, whatever drugs which is given to the patient, it should have a safety and efficacy plays the major role before treating anything, which any drug. Drugs are the tool for the health worker. Pharmacists are the tool maker. Drugs are the tool for the any type of sign of pathological sign. Or drugs are the tool for the health service. Drugs are the tool for the pharmacy care. Drugs are the tool for any type of healing service or any type of health system. So drugs are the tools, so pharmacists are the tool makers who are doing what is the importance of you should understand. So adulteration include materials added fraudulently and matters which has become associated with the drug owing to carelessness in handling during collection, preparation, packing and transport. Even while transport, temperature difference, agitation, speed of the vehicle which may crackle and also mixing of substance in the production area. Evaluation also plays a major role, and which is given in the book of every natural sources of drugs which is obtained from the plants, animals and minerals. Evaluation of physical evaluation, chemical evaluation, biological evaluation of a characteristic of the drug should be mentioned specifically in the monograph, which can be followed by the pharmacist and given. He can maintain the safety and efficacy of the supply of any crude drugs or drugs which can be supplied for the use of medicinal purpose. So uses that will be mentioned in every book in therapeutic use, pharmacological action, everything in category. They will mention very clearly regarding everything, how to apply, how much the dose and everything comes in the uses. So there are 7 parameters which has to be remembered for you to write very clearly what all the things have to be, what is the definition of the pharmacognosy, what all the things will be the pharmacognosy will deal to explain about the crude drug. So up to now we have discussed, always you have to conclude, you have to read and you have to understand. The student should read again and again, prepare yourself notes. And now I am giving something history, very very small, very very important and not important, or not important and important, like that we cannot do. But anyhow, according to the chronology, some of the things which selectively we cannot remember all the things. Thousands of people have come, contributed many things for the pharmacy developments and also the medicinal developments. So we have remembered one of the things too, or there is few things which can be expressed if suppose they are asking about write about some of the sponsorship or some of the contributions which were given and some of the chronology, some of the history of the pharmacognosy. The ancient Egyptian starts in the period of 2000 BC, where experts are doing drugs and curing diseases, and they are healing in sick undertaken by priests, doctors and pharmacists, son who prescribe and prepare medicine. They are always prescribing. So the prescribing word have come from long back, 3000 years back before Christ, and you can see that is crude drug of vegetable origin used include aloes, gums, myrrh, poppy, pomegranate, colophony, linseed, squil, coriander, onion, anise, melon, castor. These are some of the ancient drugs which they have used, which we are using some of them in our food nowadays. This is the first prescription, which is very lengthy, and prescription means we know that. Now I want to remind you, the student, actually you are a PharmD students which you are listening to me. You should know that prescription, reading the prescription and guiding that and writing the prescription. So you should know more about the prescription. What is a prescription and about the schedule N and M. You go and read and you can study about M and N. What is the schedule of in forensic pharmacy and as well as in jurisprudence subject. Maybe the word can be changed. In that you can see that how a pharmacist gets the prescription from another prescriber, and they will prepare. Even I in to 1985 when I become 84 when I got a training, and I became a pharmacist after getting the training only. So 6 months I was working in a pharmacy in a government organization, where as a trainee pharmacist, and then only I will become a pharmacist. In that we were doing cough syrups, and you can see that is we are doing many carbonative mixtures and many mixture of powders, creams, ointments, external preparation also, everything. I swear, I don't want. This is what previously the pharmacist will be doing the pharmacy, but now we are getting everything packed one, already manufactured. Another manufacturing pharmacist who is doing in the manufacturing unit, everything is packed. And even nowadays advanced technology, if we have advanced formulations like drug delivery system have gone to very extent, like transdermal system, implants, and not to have any type of through the dermis without any injury. They are even delivery system has been advanced, and the drugs are even used very low doses without any toxics. They are seeing how preventing and taking the care for the patient. That is why we are using the word pharmaceutical care, health care. These all things, the word you should understand. What is the word pharmaceutical care? What is the meaning of health care? I am telling health care system. Pharmaceutical care system is, what is the system? What is the name? What is the meaning? So you should take a care for any type of prevention is better than cure. So preventing, even though treating, you should prevent unnecessary toxication. So that's why the prescription is given in the long back. This is the first record of prescription were found in Egyptian tombs. These were the hieratic papyri, Eber's papyrus, and gynecologic papyrus. So the papyrus is written in 1500 BC, before Christ, but it believed to be having a copy like an earlier text. So that's why that much it is more advanced in 3000 years back or 1500 years back. It is more than 110 pages roll and 20 meter long, this prescription. So that's why I was taking this prescription as the number one prescription. The first prescription makes us to know as RX, where the pharmacist live and where the pharmacist stand to read and write a prescription. So the scroll contains 700 magical formulas, which I told formulas will be written in the prescription and it will be made by the pharmacist. So that's what you are also doing, the same job. Magical formulas and flock remedies. It contains many incantations meant to turn away disease-causing demons. And there is also evidence of a long traditional empiricism. So empiricism is a long traditional practice. It's a traditional system having an evidence of this prescription, having lot of magical remedies. The papyrus contain a treating of heart. Heart diseases are very common. It is self-experience which I am telling. It's become a very common now. And it was treated before 3000 years. They have noted a prescription. Notes that the heart is the center of blood supply by vessels. That now we know. We know what is the impact of a diabetes mellitus, and what is the impact of the atherosclerosis form in blood vessels, which causes blood pressure, and how the blocks comes and how the cardiac arrest has been seen in most of the places. And this has been denoted by a prescription of medical treatment in the Egyptian tomb by the papyrus prescription. You can see that is the vessels attached to every member of the body is responsible of the heart. That has been noted in 3000 years back. Now Babylonian, the next one, The Babylonian medicine was known to be loss of Hammurabi. In 772 BC, the drugs used were from vegetable origin. That means plants, sources. The drug used include 250 materials of plants, 180 materials of animal sources. Many of these drugs are known to be ancient Egyptians. And number 3 is our old Indian medicine. Indian medicine means everybody will come to know about Ayurveda. That means from Kerala originated, and it is more than 3000 years back before Christ. 2000 years back it has been practiced in Rig Veda, Ayurveda, and even that Siddha, Unani, these all are come from India. And there are Indian Rig Veda, Ayurveda, Akoki, 2000 years BC contain a scant medicine of plants. They have many plant material which has been used, especially sage, cedar, sweetgrass, tobacco, follow tobacco, and together they refer to the 4 scant medicine collection of plants material done by young and innocent, pure religious people, persons, and fresh plants have been considered to be more effective. The most celebrated Indian drugs are sandalwood, clove, pepper, cardamom, caraway, ginger, benzoin, cannabis, castor oil, sesame oil, aloes, etc. Now you know very well. Previously, now you can see after Corona, people are rushing to collect the ginger, amla, lemon. These all things makes a major role, and clove and pepper, cardamom. These all having lots of medicinal uses. Value in before 2000 BC, we have been used this one. The old Chinese medicine also acupuncture. And we are also having lots of, they used to see Reiki therapy, and there are many redeems. They will find out the meridians therapies are available, which can be Chinese medicine, which is using herbal medicine. And Pentaso Kang Mao 1000 BC, before 1000 years before Christ, containing incredible number of medicinal plants and drugs for animal origin. Their books include many recipes how to make this drug, every diseases among the plants and minerals, highly extremely for its magic healing, health including power like ginseng, rhubarb, ephedra, star anise, which we are using most of the drugs, pomegranate, the fruit which is very costly and very useful, very medicinal, aconite, opium is the opium, one of the medicine which they have used for diarrhea, dysentery. Even in India also we are using that. Many things can be discussed, but still short. 5th one, we have taken Greek and Romans. Pythagoras is one of the scientists in 500, and that means 5th century. He was in BC before Christ, not 5th century. Before Christ, 560 BC. Mustard and quill he was used, and Hippocrates you may be knowing that is also 460 BC. Was numerous drugs wrote. Carpus, Hippocratium, 460 BC. And even Greek emperor, that is Dioscorides, is one of the father of medicine. You can say he is a Greek birth as a pharmacist, and he worked. Especially he can say he was including 500 medicinal plant, animals, mineral drugs he has included in his book. That is Greek Herbal of Dioscorides. Greek Herbal of Dioscorides. He was the first, he was actually birthed by, he was a Roman Dioscorides. You can see he has to know about the Greek Empire, followed Roman Dioscorides, who was a Greek by birth. Because of his knowledge and medicinal knowledge, he was taken by Romans. Actually, he was a Greek. So you can see his books. Even Pliny, who lived about the same time of Dioscorides, who also eminent author of nature history. He was an eminent author of natural history. Yes, Galen is one of the person which you should guess. He was a pharmacist. He was having an galenical preparations like elixir syrup, extracts. He has brought the galenical preparations, how to use it. And the guy in first century, 138 to 200 AC after Christ, was a physician. He also have galenical preparation. Islamic contribution is completely a great contribution which has been given to the pharmacy field. In Islamic writing, they have found the first beginning of chemistry. Everybody knows that is derived from the Arabic word chemia. That means chemistry, chemia. That gives chemistry. So Arabic word chemia gave that chemistry. And similar word of alcohol, alkali comes from alkali. So like that, we can say Arabs added numerous new plants and medications, elegant for preparation for the Greeks, known to be Greeks and Roman. In their days, pharmacists attained the highest reputation in marketing and distributing the medicine to every countries. And Baghdad is one of the center of the first dispensary or first pharmacy. And there it was made up of sandalwood, that is why it is called Sadalia. And even you know that in Arabic, Sadali is the pharmacist name. So it was the word, it was the first pharmacy in the world, was a center of dispensary opened in Baghdad, center trade for those days. And you can see the dispensary was made up of sandalwood and it was Sadalia. And Raze in 850 to 931 AZ after the Christ, who was born in Rai in Persia, was director of Baghdad hospital in days of Al-Mansur. He published a book of Al-Hawi Khabir. And when you come to Abu al-Hasan Ibn Sinha in 980 to 1034 AC, whose name was Latinized as to Abyssinia or Avicenna, you can say. He was one of the most eminent and gifted by Arabian physician. His Canon fi al-Tab is a book. He has described the most famous book. It was more than 5 centuries it has been useful for Europe and Asia, India, everywhere they were using for 5 centuries. 5 centuries, that means from 10th century. It was written in 137 is the life, that is 1000 AC, and it came to 1500 AC. Up to that 5 centuries, it was described the most famous medical textbook ever written by having demonstrated by medical schools in Europe and Asia, and served as a chief source for medical knowledge for 5 centuries till 15th century. So that's, we cannot neglect this Abu al-Hasan Ibn Sinna or Ibn Sinna, who have been named in by Latinized like Avicenna. This student can remember Avicenna, who was an Arabic contribution. He has given a book which is 5th century, Kanun fi al-Tab or al-Tib. Kanun fi al-Tib. This is a book which is very commonly which is used. So Kanun fi al-Tib, I was just taken, which was written by Abu al-Hasan Ibn Sinha, who are called as Avicenna or Avicenna. It was completed in 1025. So that was then book remained as a medical authority for centuries. And even it has been used as standard medical book through 18th century in Europe also. And it's an important book for Unani medicine, for the form of traditional medicine practice in India. So you can see Abu al-Battar, that is the next one, after next century, that is in 1197 to 1288 AC he lived, and best, he was a pharmacologist, the botanist, and ranking 2 Dioscorides. He was before Christ. Dioscorides is respected like him. His book was Jami al-Mafrat, contained description of 200 drugs. And Sagit Dawood il-Anti or Antaki wrote a book, that is Taskarat Ulli al-Allah or al-Albar Tasarat Dawood al-Antaki, who describes several hundreds of herbs besides drug animals and minerals. So this makes you to have just a small introduction about pharmacognosy and the history. There are many definitions. There are many things which are already discussed by the teacher, and I will give you, if you need any handouts, notes or descriptions, even you can come to the you can come to my office and you can ask, or you can send messages, or you can ask, you can call also by you can send an email, you can use, and so that I can give you the materials for you and in the group, and you can collect and you just prepare for the examination. All the best, and you are starting your first sessional exam from 28th of February this month, I think next week. Thank you for listening.